Welcome to the Learn Psychotherapy podcast, presented by Sentio University, using the emerging science of deliberate practice to make therapists more effective. I'm Ben Feynman, your partner on the path to therapeutic mastery. One of the most important common factors is called goal consensus and collaboration. Basically, this means that a therapist and client who work together to identify what outcome or outcomes they want out of therapy are then increasing their chances of getting those desired results. This happens because collaborative goal setting helps to build a good relationship between the therapist and client. It helps to set consistent expectations for both people, and it creates a kind of unique roadmap for where therapy is going. The goal of collaborative goal setting is to work toward the identification of personalized goals that are appropriate for both the client and therapist. And goal setting doesn't just happen once at the start of therapy. While it's important to agree on a clear definition of what successful therapy would look like, goals can also be short-term, and they can change over time. Now, as the name suggests, the skill of collaborative goal setting is done collaboratively. You're not telling clients what to do, but instead the goals are set together and then revisited throughout the therapeutic relationship. Importantly, setting goals is not always an appropriate skill to use. There are many scenarios in which a client needs different kinds of support before goals can be identified and worked toward. But for this exercise, we're going to practice working toward clear, specific goals so that you have the skill ready to use when it feels right. Now let's talk about the skill criteria. As always, if you're practicing along with the episode, these are the elements of a good response to each client statement. Make sure that this is what you're focusing on. The first skill criteria is to begin with a short response, reflection, or validating comment. Criteria 2 is to invite the client's input on the goals of therapy, focusing on goals that are specific and actionable. And you can find these skill criteria in the show notes and on our website at sentio.org. Let's hear a client statement and sample response that meets these criteria.
I get panic attacks. I know it's not realistic to get rid of them right away, but I'd really like for them to happen less.
Great. Now let's hear a response to that statement.
Okay, that gives us a good target to keep in mind. Can we say that having fewer panic attacks than what you've been having is one of the goals you'd like us to work towards?
So the first part of that response, okay, that gives us a good target to keep in mind, meets the first skill criteria of beginning with a short response, reflection, or validating comment. Then you heard Jen say, can we say that having fewer panic attacks than you've been having is one of the goals for us to work toward? Which meets criteria 2 of inviting the client's input on the goals of therapy, focusing on goals that are specific and actionable. Okay, let's try the skill of collaborative goal setting. As always, the first segment is a demonstration. You can try it yourself or just follow along with Jen as she goes through the exercise. You can also check the show notes for the timestamp of the practice segment if you're ready to skip ahead for some rapid-fire deliberate practice. Now, let's get started.
I'm miserable. I don't even know where to begin.
It sounds like you've been really down lately. What do you think about us working towards a specific goal to help you manage this feeling better?
So I'll have you try that again. I think when you say working toward a specific goal, you're on the right track.
Mm.
And then when you say to manage feeling better, that almost
I've defined
implies
it.
that you've already recognized that as a future goal. But we want to be even more simple with that and just say, is feeling better a goal? Let's
Right,
set a goal together, and maybe that's
right.
it. So
Got
let's
it.
try that one more time.
I'm miserable. I don't even know where to begin.
Mm. It sounds like you've been feeling down for a while and feeling a little bit lost about how to proceed. Would you say that managing these feelings is a goal that you like us to work on?
That's exactly what we're looking for. You're taking something Carrie said and you're reframing it in a way that asks her, is this a goal for therapy that we're going to focus on together? So it makes the two of you feel like you're on the same page, and everything you do in therapy from there is kind of filtered through this collaborative goal that you've set. So great job, and we can go on to number 2.
I get panic attacks. I know it's not realistic to get rid of them right away, but I'd really like for them to happen less.
Mm. What I'm hearing from you is that these panic attacks are really bothering you and disrupting your day to day. And I'm wondering about whether um, reducing the frequency of these panic attacks is something you're hoping to work on.
Hmm. Yeah, I think that accomplishes the same exact thing. You didn't use the word goals, which is completely fine. But when you say, is reducing panic attacks something you want to work on or you're hoping to work on, it accomplishes the same thing of having you and Carrie figure out together, is this where we're going in therapy together? So it was a really good job with skill criteria too. And of course, you did a good job with a short response, reflection, validating comment. And let's keep going.
This is my first time in therapy. I'm pretty nervous about this whole thing.
It makes sense that, given your first time in therapy, that you're not quite sure what to expect. Um, shall we talk a little bit about what are some of the goals that you hope to get out of from therapy?
Yep, that was really great. And I liked how with skill criteria one, you mixed it up a bit. So that wasn't so much like an empathic reflection. You validated that, yes, of course, it's normal to feel this way your first time in therapy. And you did a good job asking about what are the goals that you'd like to set. Let's keep going.
Social anxiety is the worst. I went to a party last weekend and ended up leaving after a half hour because nobody was talking to me and I felt so awkward.
Mm, I hear the frustration that you have when you kind of get into these social situations and you're not quite sure how to behave around the people around you. Would you say that being more comfortable in these social settings is a goal that you want to work on?
Again, really great response. You took something that Carrie said and you reframed it in a way that was asking her, is this a goal that you want to work on in therapy? So that she can say yes or no. And the two of you can continue working together in a way that makes sure you're kind of on the same page. So you're doing great so far. And we can go to statement number 5.
My trauma gets in the way of all my relationships. Every time I get close to somebody, there's this alarm that starts ringing in my head and tells me to run away.
Mm. Um, I hear the sadness and the frustration that you have because your trauma is affecting the way you relate to people um, even till today. I'm wondering if managing these traumatic symptoms is something that you're hoping to work towards in therapy.
Yeah, I think that felt good. Um, Asking, is managing these symptoms something that you're hoping to work toward, is that same kind of question that invites Carrie to say, like, yes, this is what I'd like to do in therapy, or no, this is not, or anywhere in between. But it definitely meets skill criteria too of inviting her input on the goals of therapy. Um, and it does focus on goals that are specific and actionable because you asked her about the trauma specifically, not just what do you want to get out of therapy, which I think oftentimes doesn't lead to anything specific moving forward. Good job, and let's keep going.
My anger is so much better than when we started. Can we focus on something else?
I hear that you feel pretty good and pretty optimistic about how you're managing your anger now. I'm wondering about whether there are specific goals that you hope for us to work on together in therapy.
Again, perfect. I love the way that you said specific when you were asking about the goals because you're really encouraging Carrie to identify what she wants to get out of therapy that you can then work on together. Um, you certainly met criteria one. And the only thing I'll point out, because I think you're doing a great job so far, is you may remember this from the last episode we did. You would begin a lot of your responses with, I hear that. And so while you're still meeting criteria one, I'll just challenge you because you're doing well so far to find different ways to start your responses to Carrie just to get some practice beginning those responses differently. So let's keep
Sounds
going.
good.
Am I doing 6 again?
7, please.
7, okay. I make a decent living, but I never have any money. I just spend it all. And then I feel worthless.
Mm. Uh, I sense the frustration that you feel towards yourself about the way you manage money. And how do you feel about us looking at your feelings about money as a goal as we move forward?
Hmm. Yeah, and this time you took something very specific and suggested that this is what we work on as a goal, which is perfectly fine because Carrie can say yes or no, but it gets you closer to identifying what is this shared goal. So you did a really good job there in a bit of a different way, and we can keep going.
My son is failing out of school. His teacher called me yesterday to tell me that he hasn't been to class in 2 weeks. I had no idea.
It makes sense to me that you're feeling pretty angry and helpless about this situation, especially when your son matters a lot to you, and you're hearing all these things about how he's doing in school. I'm wondering if managing this situation with your son is something you'd like for us to work on and explore more in our subsequent sessions.
Again, really great job of connecting what Carrie said to saying, is this what you want us to be working on? And you even said in subsequent sessions, which makes it clear that this is not just a let's talk about it for 5 minutes, but a goal of therapy. And I want to point out because it hasn't been something that's come up yet, but it's a common mistake that people make when doing goal setting, is that you've done a great job so far focusing specifically on goals and not getting mixed up in asking about tasks. So, using the last statement as an example, a lot of times people will say, "What do you want to work on so that you feel better about your son's issue in school, or what should we be focusing on so that your son gets back to school, or something like that." Where it's not asking, "What do you want to get out of therapy?" but instead, "What should we do to get to that place?" And that's the distinction between goals and tasks. And you've done a great job so far, only asking Carrie about goals. So keep up the good work, and we can keep going on.
This bully at my high school keeps making fun of me because I have two dads. I spent all night crying last night. I just want things to be better.
Hmm. It makes sense to me that when you have this situation with the bully, that it causes you to feel a little bit hurt and distressed. And tell me what you think about, us working on how to manage your reactions to the bully a little bit better. Like, does that sound like something you like for us to talk about?
Mm-hmm. Yep. Really good job. Let's keep going.
I'm not sure if therapy is helping anymore.
Mm. Thank you for sharing that. I imagine it must have been um, hard and a little bit scary to acknowledge that, maybe to even feel that therapy may not be working for you as much as you'd like. I'm curious to know what specifically you'd like for us to achieve and work towards in therapy.
Mm-hmm. It's a really good response again, asking about like specifically what we can achieve in therapy together is what we're looking for here. And I think this is a good time to point out that you may not feel like in the moment this is exactly how you'd respond to a client saying, "I'm not sure if therapy is helping anymore." And that's totally okay. The goal of this practice of getting these repetitions in is just to practice meeting these skill criteria so that in reality with clients, if you feel like you want to use this skill, you have it ready to go. And so I appreciate you um, going back to the skill criteria, even if it may feel like the statement isn't exactly something where you'd immediately pivot to setting a goal. So great job. And let's keep going to the last few statements.
The guy who left your office while I was in the waiting room seemed really happy. I'm jealous. What does he have that I don't?
Mhm. I hear that you hope in some way to be happy, like like the people that you saw in the waiting room or otherwise. I'm wondering if being happier in your life is a goal that you'd like us to talk about and work on from here on.
Mm-hmm. Yeah, really good job of tying in what Carrie had said to asking, is this a goal that you'd like to work on? And it's something that felt specific and actionable because you're asking about this precise idea of being happier. So good job, and let's keep going.
I know you asked me to think about what I wanted to get out of therapy and let you know. Uh, There are a million different things. I didn't write anything down because I have no idea where to begin.
Mm, right. Well, I hear that you've really given some thoughts about what you hope to get out of therapy, and that there are a lot of things that you'd like us to work towards. How about choosing one specific one that you'd like us to focus on for right now? Tell me about that.
For some reason, it didn't feel quite like it was specific about the goals of therapy.
Okay, let's try it again.
Okay. And to be clear, what I think I'd want you to do in this scenario is be upfront about we're going to set goals together. So even if it feels like you don't know where to begin, let's try and figure that out together.
Okay.
Um, okay.
I know you asked me to think about what I wanted to get out of therapy and let you know. There are a million different things. I didn't write anything down because I have no idea where to begin.
Hmm. I hear that there are a lot of things that you've given a lot of thought to this question, and that there are a lot of things that you might want to work on together using your time in therapy. Um, how about telling me about one of these goals that you like us to work on in our session today?
I think that's still I think it's really close. And I think technically it does meet the second skill criteria of inviting Carrie's input on the goals of therapy. But just because her statement was saying there are so many different things, I think it's important to give a response that makes it clear that this isn't just picking one of those things and going from there. It's trying to get on the same page about what is the ultimate goal of therapy for Carrie in this moment. So it's less about tell me one of the things that we'll work on and more like what is the most important thing? Let's figure that out together so we can set that as a goal.
Okay.
Am I doing that one again or
Oh, yeah, please, Carrie. Thank you.
okay. I know you asked me to think about what I wanted to get out of therapy and let you know, but there are a million different things. I didn't write anything down because I have no idea where to begin.
It sounds like you've given a lot of thought to this question, and that there are many things that you might want for us to work on and explore more in therapy. I'm wondering for today's session, what is the most salient or important goal that comes up for you that you like for us to talk about?
I think you're so close. And I think the distinction is that when you're asking Carrie about the goals, like what is the most salient thing you said for today? And we're looking more big picture when we set goals is for therapy. What is the goal that we can identify for the whole process? So really exactly what you just said, but tying it more to like a big picture of all these things that you've been thinking of. What is the most important goal you have for therapy as a whole so that you can then
Okay,
identify what tasks to work on from there. So let's try that
okay,
one more time and keeping that like long-term focus in mind.
sure.
I know you asked me to think about what I wanted to get out of therapy and let you know, but there are a million different things. I didn't write anything down because I have no idea where to begin.
Hmm. Um, it sounds like you've given a lot of thought to this question, and that there are many things that come up for you that you hope for us to work on in therapy. I'm wondering about what is the most important or the most salient goal that you have right now that we can work on in therapy going forward.
Great. Yep, I think you certainly hit criteria one and you did a really good job that time of acknowledging that Carrie wasn't sure what she wanted to work on and then helping Carrie to identify what is that one specific most important thing to work on going forward, which makes it kind of the long-term goal. So good job, and we can move on to number 13.
Can we just talk? Therapy feels best for me when I can just bounce ideas off you without working on anything specific or planned.
Mm, um, I hear that you like for us to. Sorry, let's do that again. Okay, yeah.
Can we just talk? I don't know. Therapy feels best for me when I can just bounce ideas off of you without working on anything specific or planned.
Mm, I hear that you like an approach that feels more organic and conversational, right? And seeing what comes up for you. Uh, well, I am wondering what is one goal or one thing that's coming up for you right now that you'd like us for us to work towards.
Mm-hmm. Yeah. Um, Now that I think about it, I think I'll have you try that again because when you say what is one goal that's coming up for you right now for us to work towards, I think it needs to be more specific to make it clear that this is a goal that you're setting for therapy as a whole, not just for this moment. So let's try that again and really tie in that like what should we be working on as we go or in therapy or like you know long-term goal, that kind of thing, to really help give focus to the sessions that would be coming up.
Okay.
Can we just talk? Therapy feels best for me when I can just bounce ideas off you without working on anything specific or planned.
Mm. Right. What I'm hearing is that you like you're hoping for an approach that's kind of more organic when you feel like it's a conversation that maybe um um sorry, dang it. Let's just do it again. Let's do this again.
Yeah. And this is the work of it, is it's meant to be difficult at times, and just keeping practicing until you feel like you've got a good response is exactly what we're going for. So let's give that one another try.
Can we just talk? I know therapy feels best for me when I can just bounce ideas off you without working on anything specific or planned.
Mm, um, right. What I'm hearing is that you like an approach that's sort of more organic and free flowing, right? Seeing what comes up for you. So what I'm wondering about is the for therapy going forward. What is one specific goal or issue that is coming up for you that you like for us to focus on and work towards?
I think, yeah, I think that that felt good. I think at the end, talking about what are we focusing on and working toward, it kind of gives it that longer picture frame where you're saying what is the goal that we're going to be kind of organizing our sessions around going forward. And you did a good job reflecting back Carrie's feelings of wanting it to be a bit more organic. So I think that met both skill criteria, and we can go on to the last
Um,
two statements.
I actually have a question. In the previous when I said whatever I said, does that invalidate Carrie's statement about not wanting it to be too pedantic?
I think it can. Um, so do you want to get? And this is why this is one of the more difficult ones. You can give it another try if you want, and see if you can find a way to still work on collaborative goal setting while also honoring what Carrie's saying about wanting it to be a bit more organic. If you feel like there's a way you can fit what Carrie said into the skill criteria that feels good to you, we can give that another try.
Okay.
Carrie, do you want to do number 13 one more time?
Sure. Can we just talk? Therapy feels best for me when I can just bounce ideas off you without working on anything specific or planned.
Right. What I'm hearing from you is that you like sort of a more organic, free-flowing approach about what's coming up, to talk about what's coming up for you in the moment, right? And what I'm wondering about is what is a salient area that's coming up for you right now that you'd like us to focus on going forward.
So I think that goes back to the concern of, is this being specific enough about long-term goals? And if I may offer like a suggestion from the sample responses, I think the sample response for this one is something like, um, I hear you, that makes a lot of sense, that you prefer something that's more organic. but at the same time, it's important for me to know what you want to get out of therapy so I can engage with you in a way that meets those goals. So I'm curious, what is the long-term focus you have? What do you want to get out of therapy so that in these organic conversations, I can keep that in mind as we go forward? Something like
Oh,
that.
yeah, I do like that.
Okay. um, let's jump back ahead to number 14.
Last week, you told me to keep a thought journal. I tried it for a few days and it did nothing. How is that supposed to lower my anxiety anyway?
Hmm. I mean, it makes sense to me that, that you're frustrated, right? After trying out this thought journal, it sounds like it hasn't been having the effects that you were hoping that it would have. And I mean, is it right to say that reducing your anxiety is a goal that you like us to really work towards?
hmm I think that was really well done, and this statement's kind of meant to be a trap in a sense that a lot of times a response will be, how should we work to lower your anxiety if the thought journal didn't work? As opposed to checking in and saying, is actually reducing your anxiety still a goal? So that then you can identify the tasks that will help achieve that goal. So you did a really good job of not getting distracted by the tasks part of it and staying focused on, is lowering your anxiety actually a goal of yours for therapy? So great job to meet criteria two. And we can go on to the last client statement.
Do you even care about my goals, or is that just what your supervisor wants you to ask me about?
Hmm. Um, I I hear that you really want to know if I care about you and what you hope to get out of therapy. I definitely care about you, and I want to know more about what is a goal that you want us to work on today and in subsequent sessions going forward. Like what matters to you?
Yeah, I think you did a very good job with this one. Um, and this is another one of those statements that might feel like in the moment you wouldn't just go right to goal setting, but you did a good job of responding in a way that felt very validating, at least on my end, and then tying it back to, okay, so now that I know you feel this way, what actually matters to you? What is the goal you want to work toward? I think that was a very good response to close on, and I think for these 15 statements, you did a really good job.
Yay, I can rest now.
And to finish the episode, here's the practice section. You'll hear 15 client statements. Pause the episode after each one and improvise a response that meets the skill criteria. And Jen's feedback for this exercise is that it took a while to get the skill. Her instincts of wanting to explore more about the client statement kicked in, and it took some time for her to be able to narrow her focus specifically to goal setting. We actually had to re record this episode for unrelated reasons, so what you're hearing from her is her second take. And she also mentioned that it was important for her to keep in mind the need to separate goals from tasks. So, in other words, this exercise is focused solely on getting feedback from the client about the goals of therapy. And tasks, this idea of exploring the steps to then achieve those goals, is actually a different skill that we're not focusing on here. So, again, here's the skill criteria. Criteria one is to begin with a short response, reflection, or validating comment. And criteria two is to invite the client's input on the goals of therapy, focusing on goals that are specific and actionable. Let's hear the client statements.
I'm miserable. I don't even know where to begin.
That sounds tough. Maybe we can figure that out together. What specific thing about feeling miserable do you most want to change?
I get panic attacks. I know it's not realistic to get rid of them right away, but I'd really like for them to happen less.
Okay, that gives us a good target to keep in mind. Can we say that having fewer panic attacks than what you've been having is one of the goals you'd like us to work towards?
This is my first time in therapy. I'm pretty nervous about this whole thing.
Of course, therapy can feel intimidating at first for a lot of people. It's helpful to start by figuring out what you want to get out of it. Do you have any goals in particular for our work together?
Social anxiety is the worst. I went to a party last weekend and ended up leaving after a half hour because nobody was talking to me and I felt so awkward.
If you like, part of our session today can be talking about how to deal with those feelings when they come up. Is social anxiety something you want to work on in therapy?
My trauma gets in the way of all my relationships. Every time I get close to somebody, there's this alarm that starts ringing in my head and tells me to run away.
That's really tough. It can be hard to keep past trauma from getting in the way. If we were to make this one of our goals for therapy, what specifically would you want to accomplish together?
My anger is so much better than when we started. Can we focus on something else?
That's great. It sounds like we need to set some new goals. What kind of actionable things do you want us to shift our attention to?
I make a decent living, but I never have any money. I just spend it all, and then I feel worthless.
This seems important to you. Let's talk about a plan to change things for the better. Am I right that you want to have better spending habits and not feel so worthless?
My son is failing out of school. His teacher called me yesterday to tell me that he hasn't been to class in 2 weeks. I had no idea.
That's tough news to hear. I imagine you're having pretty strong feelings about it. I'm curious, would you be interested in identifying some concrete things we can work toward to improve the situation in some way?
This bully at my high school keeps making fun of me because I have 2 dads. I spent all night crying last night. I just want things to be better.
It's really hard to get bullied. I'm so sorry to hear that. It makes sense that you want things to be better. Let's look at that more carefully. How would we know if things had gotten better?
I'm not sure if therapy is helping anymore.
I'm glad that you shared that with me. It might be that we need to take another look at what we are focusing on. What do you think is most important for us to be working on together?
The guy who left your office while I was in the waiting room seemed really happy. I'm jealous. What does he have that I don't?
I can't talk about him for confidentiality reasons, but I hear you say that you want to feel the kind of happiness you saw in him. What could we work toward that might give you that same happiness?
I know you asked me to think about what I wanted to get out of therapy and let you know. There are a million different things. I didn't write anything down because I have no idea where to begin.
I know it can feel overwhelming to set concrete goals in therapy. Maybe we should use that to guide us. Let's work on helping you prioritize what feels most important. What do you think?
Can we just talk? Therapy feels best for me when I can just bounce ideas off you without working on anything specific or planned.
Of course, we don't need to set an agenda or anything like that. But just so I have an idea about what to be paying attention to, is there a general idea of what you hope to get out of our work together?
Last week, you told me to keep a thought journal. I tried it for a few days, and it did nothing. How is that supposed to lower my anxiety anyway?
So it didn't really work for you. We can talk more about the thought journal in a second, but I want to check in on something real quick. Would you say that lowering your anxiety is a priority for you in therapy?
Do you even care about my goals, or is that just what your supervisor wants you to ask me about?
I do care, but it sounds like that's something that you're not sure about. I want you to feel like I'm actually focusing on you, not just doing what I'm told. Can this be a goal of ours, to talk about this and see if you can get a sense of resolution?
Thanks for listening to the Learn Psychotherapy podcast presented by Sentio University. Visit us at sentio.org for lots of free resources, including downloadable skill criteria, client statements, and sample responses. Our guest therapist for this season is Jen Ang. Caroline Wida is our mock client / actor in residence, and the video editors for our YouTube channel are Amy D. Smith and Alex Vosh. We'll see you next episode.